Thank you so much. I would like to start with Patricia McGinnis. Thank you.
Thank you, Chairman Brown, Chairman Bonte, and members. I appreciate the opportunity to address some of the issues with Department of Health Services licensing and certification. I'm the Executive Director of California Advocates for Nursing Home Reform, and we have been working and monitoring the problems with nursing homes and with licensing and certification for over 32 years now. The hearing asked the question, what progress is being made to improve nursing home oversight? And I think the answer is pretty simple, absolutely none. There hasn't been any progress in the last 10 years, and I was here addressing the same committee about the same issues last year. I was here in 2011. I was here in 2005. I was here in 2001. And I have seen absolutely no progress. I just want to note that the people don't call us and say, oh, gee, I have a wonderful nursing home experience. People call us when they have complaints and they can't get addressed by the Department of Public Health. And we're getting more and more and more. We get thousands of calls every single year and thousands of complaints that go unanswered. Just want to correct a couple of things. Number one, we do have in the statute staff-to-patient ratios for nursing homes. That was passed through a Shelley bill some years back. The problem is that particular statute has not been funded. And it says specifically in the statute that the staff-to-patient ratios for nursing homes has to have a legislative appropriation. So I urge you, when you consider the 1629 reappropriation and we offer $2.5 billion to the nursing home industry over the next 5 years, we think about increasing the staff-to-patient ratios from 3.2 and actually implementing the ratios for nursing homes. I realize that's a completely different issue from the caseload, but we do have, and we've worked with the department over the years, over the last 20 years, in fact, to try to increase the staffing in nursing homes. There are safe staffing standards that were recommended by national organizations, by our organizations, and by CMS at 4.1. There have been all kinds of studies done, and the department should have been well aware of those studies. In any case, I want to talk today about leadership and some of the issues that that you've addressed already, some of them, and of course the complaints and corrective actions. I've attached to my testimony 4 pages of reports, media reports, oversight hearings, litigation, Bureau of State audits, the CMS warnings and sanctions, audits by the LA County, the Office's Inspector General, the Governor, the Government Accountability Office, and on and on. And I guess the question is, how much more do we want to do, or how many more reports do we need before we know that enough, as Assemblywoman Brown said, is enough? I want to also note that the only reason the department today is responding to complaints within 24 hours, complaints that of imminent danger and death and serious bodily harm, or within 10 days, is because we filed a lawsuit against them back in 2006, and we got a state injunction against the department to force them to comply with those statutory timelines. That statute, again, was passed by the legislature, and unfortunately, over the years, the department's response to legislative statutes and to legislative pleas to please do your job is to basically thumb their nose. So, yeah, I'm really angry, and I'm angry on behalf of all the residents that we have to deal with and their family members every single day whose parents are lying in their own feces and waste, who file a complaint with the department, and then they hear nothing for a year or 2 years or 3 years. I think that the problem is the department's leaders. It's not just leaders. They need a vision. They need to go back and understand that their job is supposed to be as a consumer protection agency. If they're not going to respond to complaints, if they're not going to file citations, if they're not going to collect the fines when they file the citations, if they're not going to issue substantive deficiencies that really make a difference, then in essence, we don't have an enforcement agency in Sacramento. We have got to bring this department around, and having the same leaders running the same district offices, and believe me, there are exceptions to this, but some of those people have been there for the last 25 years doing the same failed policies. And certainly that's true in the Sacramento office. I'm sorry, I'm off base here a minute bit, but it is very, very true, because I think leadership and vision are the most important issues that we need to talk about. In November, you might have seen the Sacramento Bee's articles about the nursing home chains that showed some of the largest for-profit chains in California have very low staffing levels and very poor track records. They found that the department is not doing anything to monitor these chains, and in fact, I will tell you, the department, for the most part, has no idea who owns and operates nursing homes in California. The one facility that they did close, that they were talking about, that they suspended the license, I'll have you know that same operator is one of the largest operators in California, and he's also been given permission to operate 17 other facilities without a license. So I know, that's what we say too. We go, how can this happen? But that's just the way the department operates. They don't really have the control over what they should have control over. If the department had its way, the legislature would basically rubber stamp its plan to add 250 more positions and go along with the excuse that its problems are caused by lack of staff. However, this is doomed to fail. If you remember, we've been through this path before. In 2006, the Bureau of State Audits took on licensing and certification for their failure to meet the investigative timelines, prioritize cases by severity, provide reliable investigative data, or give timely responses to complaints. Instead of calling for reform or for heads to roll, the legislature and the administration agreed to an $18.5 million special fund appropriation, and this was in 2006 and 2007, to create more than 140 new positions for the department. What the department noted in their request would allow it to complete all required state licensing and federal certification workload, including complaint investigations, periodic survey inspections, and monitoring of medication-related error reduction plans. Does this sound familiar? Because this is exactly what they're doing this year. Obviously, that didn't happen. Instead of using the money to improve the oversight and complaint process, I'll tell you one of the things they did. They used hundreds of personnel hours and untold department resources to gain accreditation from the Public Health Accreditation Board, a distinction that, frankly, few, if any, Californians give a hoot about. And what the department did not disclose is that the activities of the Licensing and Certification Division, which makes up about 1/3 of their obligations, is not even included in that accreditation report because they are also funded by the department, by this federal government. So, had those failures in licensing and certification been included in their application for accreditation, I doubt that this wasteful exercise would have resulted in any such approval. The disgraceful response to complaints is in the news because, again, the state auditor is finding that the department has a backlog of at least 11,000 open nursing home complaints. And although this isn't news to us, we hope this time that the department would at least be shamed into action, but just the opposite is true. What kind of plan would allow the possibility that existing complaints of abuse and neglect won't be addressed for another 4 years? What kind of plan would allow people who have filed complaints that their mother's being abused, that their father's being neglected, that their brothers or sisters are having bed sores, what kind of plan would allow that to go on for another 4 years? I just think it's indicative of what the attitude is at the Department of Public Health right now in licensing and certification. Frankly, I don't think the department has any idea what staff needs are in their department or in the district offices. I will say that if the department signs off on if the legislature signs off on the department's budget plan, we have the department's word for exactly what it will do. You know what they're going to do with that money. Currently, evaluators out in the district offices are forced to close complaints to meet deadlines. Believe me, if they didn't have an injunction over them, they wouldn't even be bothering with these deadlines, and they didn't before we filed the lawsuit. You cannot trust the data that the department posts on their website. They talk about 3,000 this or 3,000 and that. I will tell you right now that data is incorrect, because the department is masters at smoke and mirrors. And one of the things that they always do, 90% of our complaints are closed or within 90 days of completion of the investigation. And exactly what the state auditor is pointing out, yeah, but when was the complaint filed? And how long did the investigation take? And that is the essence of what the complaint problem is. I will tell you our concerns with the department also applied to the Los Angeles County Department of Public Health. The squabbling over the number of positions that the county needs to carry out its obligations is basically a distraction from their dreadful performance down there. They are the proverbial fox guarding the hen house, and it's been long acted as if it was a nursing home provider protection agency rather than a consumer protection agency, and we don't see any signs that its current practices are going to be changed, the practices that were exposed last year. The department's oversight of nursing homes is failing at every level, not just about complaints. We have critical federal enforcement actions that are almost never taken. The department has all kinds of tools in its toolbox to enforce the laws. Even when the department determines that a resident has died due to abuse and neglect, it usually waits years before it issues a citation, and it leaves little room for the Attorney General to file any criminal action against that facility. Someone asked for an example, and I have that in my testimony, but for a citation was issued in November 2014 for a fall that occurred 3.5 years earlier. In this situation, the resident in May of 2011, a resident with amputations below both knees, fell from a special toilet for people with limited mobility. Because the because the facility failed to put on the person's leg prosthesis, the person fell, they had a head wound, and a cervical spine fracture. That was in May of 2011. The citation was issued against the facility in November 2014. Now imagine if you were the person who filed that complaint on behalf of your father, or you filed that complaint on behalf of your mother. Hundreds of nursing home residents are evicted or illegally or transferred every year without any intervention from the department. Although residents are granted a hearing, even when they win the hearing, and we pay administrative law judges through the Department of Health Care Services, the administrative law judge says, yes, that facility has to take you back. The administrative law judge issues an order, tells the facility they have to take the person back, and the facility absolutely refuses to readmit the resident. Why? Because the department does nothing to enforce the law except to issue a citation for $5,000 or maybe $1,000. For most nursing homes, that's a bargain because they're able to evict somebody who's not on private pay anymore, somebody who's not on Medicare anymore. They can evict that person and they can open that bed up for another private pay or Medicare person at 3 times the rate that they're getting. In fact, one evaluator noted in the citation that one of the admissions persons said, "We are not accepting the patient back to our facility. I've spoken to the administrator, and we are aware of the penalties and fines for patient dumping and do not care." And why would they, when there's no enforcement of these illegal transfers and evictions? We agree with the state auditor's assessment that the Department of Public Health is a high-risk agency, and unfortunately, it's the only agency to which long-term care consumers can turn in California. We have 4 primary recommendations, and one, as I said before, visionary leadership is urgently needed at the Department of Public Health Licensing and Certification and at the district offices. The same people have been making excuses and implementing the same dangerous and misguided policies and procedures for the last 10 years, in some cases 20 years or more. Throwing more money at DPH didn't work back then in 2006 and 7, and it's not going to work now. In some ways, the legislature and the administration has to demand accountability. We have to demand accountability. We'll be here again next year, 10 years from now, doing the same thing if we don't demand some accountability. Nursing home residents in California deserve better than this. I urge you and the legislature as a whole to support Assembly Members Brown's AB 348. We are the proud sponsors of that bill, and that would require the department to complete investigations within 40 working days of receipt of the complaint. Would make a major difference to consumers in California. We are also sponsoring AB 927, Assemblymember McCarty's bill, that will require and establish ownership suitability and disclosure of ownership for nursing home operators and owners in California. As the Sacramento Bee series revealed, the department often has no idea who owns or operates these facilities, and some of the poorest performing providers are given carte blanche to take over even more facilities. AB 927 would establish the suitability requirements and ownership disclosure requirements that we sorely need. It would provide the department with the kind of information they need to make better choices to whether approve licenses, and it would provide consumers with the kind of information they need to make informed choices about quality of care. And finally, we need protections. We need a lot of things. These are just some of the highlights. We need to protect residents from patient dumping. The department needs to be ordered to use its full range of state and federal sanctions, including referrals to the Attorney General's office. After all, they are the agency who are supposed to be representing the department in these kinds of actions, to prevent what is becoming an epidemic in nursing homes, evicting and transferring out those whose residents whose private pay has run out or whose Medicare has run out. These Medi-Cal certified facilities, and mind you, 80% of the nursing homes in California are certified for Medi-Cal. They're happy to take a Medi-Cal resident when beds are going to remain empty, but they're happy to dump them whenever they can get a private pay or a Medicare person to fill those beds. But those facilities sign a contract under penalty of perjury to comply with state and federal laws, and those laws should be enforced. Again, I thank you very much for holding this hearing and for asking for our information.
Thank you so much for that testimony. When I think about what you just said and reading along as well, I'm concerned even more so that this has been going on for a long time, much longer than the new person who is over DPH is there. Iacino, yes. She's new. The next person is Kim Coward. You want to just start? I've already introduced you.
Oh, okay. Thank you. I represent the nurses that work for the state of California, the health facility evaluator nurses. And I actually had the pleasure of interviewing 5 of them about 2 weeks ago from 3 different district offices. And it was quickly obvious that we had some serious concerns about the department's ability to run the LNC program. And I'm going to address some of the issues that were brought to us from the actual HFENs that work on the ground. And that they said basically contribute to the inefficiency or what we think contributes to the inefficient and ineffective management of the program. First is pay and recruitment and retention, which the department made as part of its program, but I could never understand how or what the actual plan was to recruit and especially retain the nurses in the state. As we've stated before, the nurses actually make considerably less than other state nurses and also nurses that actually work in LA County. And they actually do have to go into LA County sometimes and do surveys in LA County. Next, they mentioned about training. The state is losing out on investment in the workforce. They said it costs upward to $100,000 to train the nurses. And we know, as stated earlier, it takes a little over a year to train, but even after training, it takes even longer to get acclimated to the position itself. But the state doesn't pay these nurses, of course, close to what the rest of the state even makes, and LA County. Also, with the training, the private sector also benefits from the amount of money that the state spends on the training, because a lot of time the nurses will get the training. They may work for a year, and then they'll go somewhere else. Take the skills that they've learned from the state, the money that the state has invested in them, and go work as a consultant somewhere else, and sometimes maybe even for the facilities that they maybe once surveyed. You never know, but that has been an issue that they brought forward, and they have brought that forward actually for the last few years, and I'm sure it's been longer than that has been happening, but that's a concern that they've brought forward. Lack of resources. Currently, our nurses are forced to use their personal cell phones so the department can reach them. What is even more concerning is that they're told to use the facility that they just went in there to possibly investigate and use their facility phone. And I'm here to tell you that's an uncomfortable situation to say, excuse me, I just cited you, but can I use your phone to turn you in? I mean, just imagine the position the nurses are put in when asked to do this. And we've met about this with the department more than once, more than twice, more than a year or 2 years ago. We have brought this to the attention of the department, and it continues to happen. Reimbursement for travel. Currently, our nurses are forced to go, of course, over the state for surveys and investigation complaints. And training for reimbursement, especially with new employees, apparently doesn't come very easy, because it takes months sometimes for them to get reimbursed if they don't fill it out correctly. So, and just like with the cell phones, we're paying the state to work for the state. So I may schedule a flight with my own credit card, but I may not get reimbursed for 2 months. It's those kind of things that doesn't make an attractive or it makes the state attractive or desirable to work for, along with the fact that, there is a recruitment problem to begin with, especially with the disparity in pay. Also, with the reimbursement, I think it's one more thing. As far as the investigation of complaints, and I mentioned before that they actually have to travel across the state, so that goes along with the reimbursement. Tablets. They mentioned the tablets. Our members report that the use of tablets will not ease their workload. There are forms that still have to be filled out, and even if the form is placed on the tablet, CDPH does not have the technology to automatically upload those forms to a system. The nurse will have to send the information to another system and print the information out. This adds another tedious step to their process when they can just fill out the form while they are surveying, like they are currently actually doing. Also, the issue of the non-nurse evaluators was brought up, and our nurses report that it takes up to 3 years to complete training to become a health facility evaluator nurse. This training requires the use of clinical skills and knowledge to interview doctors and RNs. Nursing skills are needed to make sure the medical aspect of care is not neglected. Without a medical background, this job cannot be done, and I can attest to that. I work for the state of California. I work in the Department of State Hospitals as a registered nurse. Initially, we thought CDPH was looking to hire more health facility evaluators that are responsible for making sure the physical structure, the HVAC, fire alarms, beds, etc., are functioning properly. Those health facility evaluators, as opposed to a health facility evaluator nurse. When we learned that CDPH has gradually been phasing out this classification. Currently, I think there are only 7 left in the state. Without this type of medical background, how can clinical evaluations be completed? So they phased out the ones that have actually do the work for the fire alarms and the beds and the structure, and actually left that up to the work of according to, the nurses that we talked to. That work is now being left up to the health facility evaluator nurses. Caseload. Our members report having an average caseload when we were talking to them at that time of 20 to 28, but one actually reported having a caseload currently of 98 on her desk. And as of probably about 4 or 5 days ago, I talked to one of the nurses that were on the call, and she went back to her district office and then was asking the nurses there about their caseloads and what's the most they've had, and one said she's had over 200 before on a caseload. So it varies throughout the state, but it is an issue. Because CDPH is short-staffed, our nurses report that they have to put complaints down to deal with surveys and priority one complaints, which are the ones that are immediate jeopardy. So essentially, you may have a caseload of 98, but when you have one you have to immediately take care of, you have to drop that and go do it, or you have to actually put those to the side to do surveys, because surveys are a priority. Additionally, 2 nurses reported that their oldest open case was from 2012, and one reported hers is from 2013. They say that it takes 1 day to 2 years to process complaints, depending on if there was a death. So in their minds, it either can be a day or it can be up to 2 years, depending on the severity of the complaint itself. Surveys. Our nurses report that they used to go out and interview teams that included a health facility evaluator, nurse, dietitian, pharmacist, and social worker. The state cut the interview teams, figuring the nurse could do the surveys and save the state money in their mindset. And so the result was the backlog of cases. And I just want to thank you for your time.
Thank you very much for that informative information. Next, we have Melanie Boston.
Hi.
Hi.
Hi, thank you and good afternoon. My name is Melanie Boston, and I've worked as a registered nurse with the County of Los Angeles for over 20 years. For 12 of those years, I've held the position of a health facilities evaluator nurse, exclusively surveying the skilled nursing facilities. The constant presence of evaluators in the facilities is necessary to maintain a certain level of quality in the nursing homes. And although we do not have the nursing homes of the 60s anymore, we still see systematic failures and unacceptable occurrences that put residents at risk and result in harm. We routinely investigate complaints of physical and sexual assault, and in the worst case scenarios, even death. I know a thing or two about oversight. The quality of care and the quality of life of the residents are improved when there is direct oversight that we as evaluators provide. Our nursing background, training as evaluators, longevity with the department, expertise in our varied fields have made us the ultimate patient-resident advocates, and the facilities are held accountable for care they provide to the residents when we are in the field. Over the last few years, the program has been faced with many challenges of its own. These challenges are due to the state's systematic failures, a lack of clear policies and procedures consistently applied throughout the program, whether at the state or at the county level, a dire lack of funding, which has led to short staffing, and a lack of support staff. These failures have resulted in a mountain of backlog cases and a program that is straining to keep up with the overwhelming demand for timely responses to serious complaints. We agree with the need to focus on staffing and prioritizing the most serious cases, and want to ensure that the state is planning for a future where all mandated state and federal complaints and investigations are being fulfilled in a timely fashion. We are far from that vision. We continue to work back-to-back surveys. We do mass amounts of overtime, and we still are not able to decrease the number of backlog complaints or complete our surveys on time. In the past, Los Angeles County has entered a new phase. In the past year, Los Angeles County has entered a new phase as well. We are under new management, we're receiving additional training, and the steps have been taken to clarify procedures. We are an amazing team of committed evaluators, and when we are appropriately resourced, our program is strong. I urge the state and county to continue along the path of reform. However, as experienced surveyors, we need to be more actively engaged by the state in creating these reforms. The state needs to understand from us where the gaps exist and how to ensure that the changes we all envision are lasting and real. We stand ready to do what is needed to improve the integrity of our program so that my colleagues and I can fulfill our mission to protect nursing home residents and hold nursing homes accountable. Thank you for the opportunity to share with you today.